Good morning. I want to thank all of you for being here today. I'm Deanne, the CEO of the company, and I wanted to take this opportunity to cover some information about what we're dealing with the pandemic. So we're going to be covering working with COVID-19 population, the facts versus the hype. I wanted to first give a little bit an explanation of my experience, just so you kind of know where I'm coming from. But I've been a registered nurse for 32 years. My previous clinical experience in the hospital, I was an ICU nurse, I was an emergency room nurse, I was a recovery room nurse. I also then eventually was supervising hospitals by the time I was 28. Most of you know, we're serving various areas: Tulare County, San Luis Obispo County, Santa Barbara County, I'm missing some, I'm sure, Kings County, and Fresno County. Anyway, we're kind of all over, and some in Madera County, and maybe in the top part of Kern County. So we're kind of all over the place. But I do want to reference, when I was a nursing supervisor, I've also worked in Santa Maria County. Or Santa Barbara County. I used to be a nursing supervisor at Marion Medical Center, and during that time, I had an episode where I actually had an opportunity to be on shift when there was an issue that was, I would consider it to be a pretty stressful situation. The entire town lost power, and so the only place that had power was the hospital, and I was the nursing supervisor on, so I had to hold the staff together because, of course, nurses wanted to leave. They wanted to go home and see their own family. And if you can imagine an entire town being on a 4-story hospital and looking out from that 4th story and seeing nothing but black was pretty scary. And so, so I've had some different experience. I've also been I was elected to the hospital board at Tulare District for 8 years. I served on a state level board for district hospitals, and I created both Amdal in-home care and Amdal transport services. So what we're going to cover today is the beginning of COVID-19, the hype, the damage, the numbers, what's symptomatic versus non-symptomatic, safety and PPE, the future in caring for COVID-19 clients here at Amdal, and our commitment to you, both transport and home care. So let's talk a little bit about the beginning. You know, I'm sure most of you know this started in China. I myself kind of became aware of it about the 2nd week of January, so I have been following this pretty closely since then. I had the opportunity, when I started reading about it, I ordered 20 N95 masks thinking, okay, what's going to go on with this? And I wish I would have had, forethought to think about ordering a lot more supplies and a lot more masks at that time. But I wasn't even sure myself what was happening. I mean, I was reading this and I was following stats closely, and then I started looking at Thailand. And I actually have, in my life, I've had 5 exchange students, and one of them is somebody that's in Thailand. And she's actually a medical student, and she was working at the first hospital that Thailand had a COVID patient. So I reached out to her and I asked her in January, and that was about, I looked back on my instant message in Facebook, and I reached out to her, I think on January the 28th. And she told me, the patient's doing fine, everything's good. Well, Thailand's statistics and China's statistics ended up being way different, way different. Thailand's death rate is something like, I don't know, 0.4%. It's very low. So Thailand obviously did a lot of good things in their country. And when I talk about that, just to give it some perspective, Thailand is a country with 70 million people. So it's not just a little small place. There's quite a big population there. So they obviously were controlling it real well. So then I was feeling a little comfortable, like, okay, this is, it seems like, everybody kind of hears things about China. We don't always know what's going on in China. So I took it with a grain of salt and thought, okay, maybe this is not as bad as some of these crazy videos that you were seeing about China. Then Italy came along, and then you look at what happened in Italy. And so Italy now has a death rate, I don't know what the newest numbers are, but it's something like 10 to 11%. It's pretty high. So Italy then is obviously rating a little bit different than the United States. The United States overall, I believe, is around 2%, for death rates of those that have COVID-19. And it's also going to be very individual per state, and it's going to be very individual per area, and it just is. I mean, I don't want to, toot our horns so great in California, but we have some of the best healthcare in the nation. And we're really lucky with that, and it's because we are a desirable place to live. So we do get doctors that want to practice in these areas. But with saying that, there's even more desirable places to live in California. So there will be people living on the coastal cities. You know, you're going to get the best doctors that they have the ability to go wherever it is that they want to go if they're really great. And that's how healthcare unfortunately works. And that's why when you're going to see in the US, there are going to be states that are going to pull the numbers out of perspective related to California. And I'll give you one example. Louisiana is trending to be that way. So Louisiana's death rates are a lot higher. And so, but Louisiana is kind of a poorer state. And when I've done various studies on other things, their wages are low. It's a very depressed kind of economy. And it's probably not something that they're not going to get the best of the best there. And so Louisiana is not going to be the same as the United States, or excuse me, as California. And so again, but it's all one big average. Now, Italy, on the other hand, I don't think everything is known, but there are some different things about Italy. First, the way they live is a lot different than the way we live. It's a lot of people in a more compacted area, similar to probably what you're seeing in New York City. You know, again, a lot of people in a very small area. The other thing about Italy is that you have a lot of people that are smokers. You have a lot of people that are overweight, and not that we don't in the United States, but those are all factors that contribute into this. The other thing about Italy, it's a very huggy, touchy, loving kind of group of people. It's in their culture to kiss all the time, kiss each other on both cheeks and things like that. So there are differences between Italy and the United States. So we're going to touch on really about a pandemic. We're going to touch on a virus, what is known and what's not known, and I'm going to get into a little bit about the U.S. and PPE. But I know this is kind of a crazy slide here, but I saw this and I wanted just to define what is a pandemic. It's an epidemic or an outbreak of disease that spreads across a large multinational area. And I know this is kind of hard to see in this slide, but so viruses it's transmitted airborne from person to person, spreading. It could, it's in how we travel today in today's world, that's another way that this has been spread. I mean, that's probably what first initially happened here in China, there were people that were still moving around in airplanes, and it was their Chinese New Year's, but so there's a lot of things that played into all of this. And I know this is difficult to see here, and let me see if I can get my little pointer. Oops, wrong, didn't do that right. Anyway, I'm not always the best on technology, so I don't remember where the pointer is. Anyway, I wanted to mention about some of the pandemics, and I know that when I've sent out memos before, you probably have read that, it did affect my family. My granddad, he was born in 1917, the year that the Spanish flu started. And so in 1918, his mother died and his twin. And so his twin was only 1 year old. So my grandfather obviously survived, that pandemic. Can you imagine as a small baby, he made it through, but yet his twin didn't. And that's kind of what happens with viruses and how it's going to move through people. There are going to be some people that they're never going to get it. A virus needs a host, and it needs usually a weakened host, and that's just how viruses work. And so if your host is strong, meaning your host is our bodies, and so if your body is strong and you don't usually get a lot of diseases like flus and different things like that, chances are this maybe won't touch you. I mean, I'm not going to guarantee that, but that's how pandemics will work. It's not going to touch every single person. It's going to touch us in the sense that we may know somebody. We may have, a loved one, a neighbor, whoever it might be, but it doesn't mean that it's necessarily going to get it to us. But it could. I mean, I don't want to sugarcoat that. So there have been other pandemics here. Obviously, when HIV came out, AIDS, in what was that, 1987? So when that came out, I was actually in nursing school in 1987, and I remember that I worked at Kauai Delta as a nurse's aide, and we had, on the floor that I was at, we had one of the first AIDS patients in that hospital, and it was a man that was in his low 30s, and I went into his room, and back then they kept the door all closed, and this is when a lot was not understood about AIDS. So the door was closed, nobody would go into him, the room was real dark. I mean, it was very depressing. And I was young, and I went in and I talked to this guy, and he family weren't really coming to visit, they were out of the area, and they had sent him this box of hard candies, and he said, I don't have any appetite for that. Why don't you take it out and share it with the nurses? So I did, and I could not believe how I was received. I mean, there were people that freaked out. Now, there were others that were not that freaked out, but you have to remember, AIDS is blood transmission. It's not respiratory. It is not airborne. It is blood transmission. There has to be a connection of blood. And the AIDS virus is very frail as far as, like, if I was to be bleeding here and I dropped my blood on the table and Serena was to walk over and touch my blood, that dies within 3 seconds. Blood is, HIV dies out there on the table within 3 seconds. So Serena going and getting, and maybe if she smears her hand in it and she's got a cut on her hand, maybe there's a chance she's gonna get AIDS, but probably not. I mean, that's pretty extreme. So the nurses immediately, one person just, and remember, I was a nurse's aide, and so sometimes nurses' aides aren't treated as nice by nurses, and I know that. It's always been something that's been a pet peeve of mine throughout my entire career. And so that nurse immediately picked up that box of candy and threw it into the trash. And she goes, "We can't do this." And I thought, oh, that's so crazy. And so a stigma definitely was developing with AIDS patients. I mean, there's just no ifs, ands, and buts about it, and that's really unfortunate. So anyway, that's kind of about a pandemic. I wanted to, let me see, virus, what is known. What is known, and is, first let me just kind of touch about that, is what is known about this virus is it's a weak virus. COVID-19 is a weak virus, and so what they are saying about this is that soap and water kills it with ease, and so it's not, so that's really important. I can't stress that enough. So it is a weak virus, but they really don't know how it's spreading so rampantly. I mean, I think that, and when I say that, because it is airborne, I mean, even me sitting here talking to you, and I know the rest of you can't see the people in the room here, but we're all practicing social distancing. I'm standing here, but as I'm speaking to you, there could be a chance that some spittle's flying out of my mouth. And so if Serena was over here right next to me and I'm talking and my spittle like falls onto her, or her mouth's open and it goes into her mouth, yes, there is a chance that if I have COVID-19, that she's going to end up having COVID-19. And so that is something that is known about this, and so it's going to be real important that we remember that and why social distancing is important. But let's talk about how it spreads. So it's spreading person to person, and it's usually within close contact because it is airborne, and that is why this is real important about the 6 feet right now. It is definitely through droplet. And when an infected person coughs, sneezes, or talks, like I said, little spittle flying. These droplets can land in the mouth or nose of people that are nearby, and they can be inhaled into the lungs. And that is how it's going to end up happening. Now, there are some studies that are suggesting that people are spreading this and they're not showing any symptoms at all. Those are people that are what are considered asymptomatic, and there are people that are carriers that are not going to show any symptoms. Now, I know you're hearing this about, that it lives on cardboard in your groceries and things like that, which it is true. I mean, that is true. But what I've been reading and what I've been reading all about this is that transmission from that is actually pretty low. I don't even know that they've tracked a lot of cases to that. So they, if they went into a grocery store, chances are if they went in and checked and spot checked a grocery store, there is going to be COVID-19 somewhere. It's going to be, and I don't mean to freak anybody out, but it is the truth of the matter, because chances are when 1/4, and I haven't got to that yet, but I will, so let me wait on that. But so the number one thing you can do is cleaning your hands, and this is so important with soap and water. This has always been a thing that I have done, I have practiced. When you go through nursing school, you realize that germs can kill you, and you see things in the ICU, you see things that that there's just some bad stuff out there. So I have always been, my husband has joked that I'm fixated on washing my hands. Okay, maybe there's some truth to that. I am. But it's because of my experience and what I know about germs. And so things like a contagion, a spread of a virus like this has always been in the back of my mind as a fear of something that can happen. And obviously we're facing that today. So soap and water is the number one thing that you can do. Now you notice here it says if a hand sanitizer, you know, if you don't have the ability to use soap and water, then hand sanitizer is the next best thing. But I don't want to get that confused. We had a caregiver, she was concerned because the household that she's taking care of somebody, they don't have any hand sanitizer. Well, that is not a necessity. What is a necessity is soap and water and the ability to dry your hands with a clean towel. That is what is most important. So I don't want to think that if you don't have hand sanitizer that you're in trouble. All you need is a good bar of soap and friction of rubbing your hands. And they are really, that is the number one thing. And you've got to remember, you have to avoid touching your eyes, nose, and mouth with unwashed hands. I know some of you here have heard me talk about this, but my husband is a major face toucher. You know, he's always touching his face. And he's not been the best about hand washing. I mean, I've been married to him for 36 years, and I love him dearly, but he can really gross me out at times, and I'm dead serious about that. I mean, he can do, you know, sneeze into his hand, wipe it on his pants like that, and just, I'm like, are you kidding me? Go and wash your hands. So I really believe, in my memos you've seen this, I believe my husband has already had COVID-19. And as soon as there's the ability to test for antibodies, I want him to be tested. And he, you know, and we were in a situation, we were in Monterey County. We went to a place that had a museum, and my husband was the only one that used the bathroom. There was a huge group of Asian people, and I'm not trying to be racist or judgmental or anything. This was at the end of January, and so some had masks on, some didn't, and of course this was all just starting, and I was thinking, okay, they're coming from China, so they're paranoid and they're wearing masks, and you know, but my husband, again, he was the only one that used the bathroom. In a matter of days, I would say, I don't know, maybe 4 or 5 days, we had came home and my husband was pretty sick. He immediately went to the doctor, got tested for the flu, and it was negative. He probably bounced around with, you know, a fever, I'm gonna guess about a week or so, maybe 7 to 10 days, but it was the cough that was the thing that, I mean, he actually, after the 7 to 10 days, he didn't really feel that bad, but that cough lingered for probably, for him, it lingered for probably 40 to 45 days. It went from February 1st to about mid-March. And I mean, it was that kind of cough that it was like dry, and I'd ask him how you felt and different things like that. And he was like, I'm fine. It's like, but the cough was incessant. I mean, it drove me nuts. It was like, at night, I would say, please just take some NyQuil. And he'd say, I don't feel that bad. And I said, you may not feel that bad, but I need to get some sleep. So please take the NyQuil for me. You know, I need you to try not to cough all night. So anyway, and Serena believes that she has had it, you know, and this, because this has been different symptoms as far as how that goes. And so, anyway, I can't stress that enough. Wash your hand. If you are going to have a sneeze or a cough, it's important to do things like this into your elbow. You know, you don't want to put it on your hand and then go like that. And if you do end up doing that, then you need to get in the bathroom and wash your hands. But you need to cover your, maybe if you have a tissue, cover your face, do something like that. And then again, after that, you need to wash your hands. It's going to be important to clean and disinfect surfaces because, again, if there was enough of the virus, now one little piece of a virus is probably not going to be enough. What I've read about in the CDC data is that it's not, usually one little speck of virus is not, you're not going to be able to go and touch this surface and then come back. I mean, yes, it's a possibility, but it's going to take some to do that. So where that's important is when you think about our client homes. You know, a lot of elderly people that we take care of, this is their home environment. They may not be the best about, you know, their secretions and coughing. I know I've been in houses where, you know, there's a lot of tissues all stacked up, all yucky and used, and, you know, it's not getting into the trash can and things like that. So this is going to be really important for our caregivers in homes, is to help keep surfaces clean for people, you know, and that's what you could practice in your own home as well. And I will say, we are doing this here. I see Serena going around spraying doorknobs with Lysol, you know, using the Clorox wipes. We're trying to wipe all the doorknobs down and things like that, areas that people are going to touch. Now the CDC came out with that it's going to be important to cover your mouth and nose. They want to really reduce this spread. And so we're going to you want to cover your mouth and nose when you're out in public. Now this is something that they just did, I believe, just last week. And at first they were saying this didn't matter. But in some countries, you're finding that in their outbreaks that it has mattered. And so people are doing all kinds of crazy things as far as what they're covering their face with, and because that's what they've had to do. I mean, we've all probably seen the videos of somebody using a bra, maybe underwear. In other countries, that's what they've resorted to. But in some places, like I think in Taiwan, they made it mandatory from the very beginning. You couldn't leave your home without a mask. And so you'll see that the outbreak has really been a lot lower in some of those countries. And so that's really important. So that's going to be, you want to make sure and cover your mouth. If you have a child under age 2, they don't recommend that you're putting a mouth covering or a mask tied onto somebody's face, because you don't want to create a problem. If somebody has difficulty breathing, if they have underlying respiratory issues, it's going to be very difficult for them to have a mask on their face. And obviously, if somebody's unconscious, you want to be careful of that. If somebody's not breathing or unconscious and they can't remove the mask themselves, then that causes a difficulty. And so that's it. The cloth over your face is meant to protect others from you. So it's kind of a dual method. So if I was up here doing this presentation and I had a mask on right now, I'm protecting my spittle from going out into the room. And that's protecting all of you. It's not so much that the mask is protecting me as much. It's protecting my germs from going out to all of you. And so if all of you were wearing a mask, then we've got dual protection. So your secretions are staying in you, my secretions are staying in me, and it's less likely that it's filtering throughout the room. Now let's talk about the hype. We have seen an unprecedented stay-at-home order in our country. I mean, it started obviously in the state of California. It started in individual cities first, and then it was our entire state. And it's not nationwide, obviously, yet. I mean, and it may not be. I mean, it may not go to that. I believe there's only 5 states, I think, that do not have a stay-at-home order, but all the rest of them do. Some are policing. You've got neighbors policing neighbors. You've got, some things are an overkill. I know that, I know I keep bringing Serena up in this presentation, but her husband was actually stopped last week, and he was coming home from his job at 6 in the morning in Kings County. So Kings County has chosen to really enforce and check up on people that are out driving, and so he was stopped for no other reason but to ask why he was out and about. And so that's a little scary to me. I mean, on a whole different level, but we won't get into that. But he did have his papers. I mean, it seems kind of crazy to say that, yeah. But to be able to say that he was an essential worker and he was coming home from work, and the officer went back to his vehicle, checked everything out, and let him go. But that's kind of what what we came down to. I mean, I know that some of you probably see the same type of thing. I'm seeing things on social media where people want to call and report that somebody's having a barbecue in their backyard, or, I mean, I saw something the other day and I thought, is this really true? But it was the Coast Guard boat or some police boat, off the pier of Pismo going after an individual lone surfer. Now, I'm sorry, but that's crazy to me. I mean, you've got this huge, big, vast world, sky, ocean, and you've got one little lone guy out there surfing. I mean, one thing that is really healthy during this whole process is to keep this healthy, is to keep your mind healthy in dealing with all of this. And so I think that that is just really discouraging to see that those kind of things are happening. So the other thing that we have is we have news stories going 24/7. We have news stories that are playing 24/7. I mean, 24/7. And not only do we have news stories playing there, we have scrolling death numbers. And so we're seeing that this constant increase, and it's kind of creepy because, they'll change right there when you're watching them. It's like, okay, there just went another one, there's another one. I mean, it's just, so it's very overwhelming. The other day I had somebody say to me that, well, didn't you see the reefer trucks that are in New York City with all these dead bodies? And I'm not going to flip to this right now, but if anybody wants this, I'll make sure that it's accessible. But that is incorrect news. That is definitely incorrect news. You could go to this fact check on this, and that is incorrect. I mean, because of the stay-at-home orders, they are recommending that we don't have events greater than like 10 people. And I know somebody right in this first week that this had happened, you know, she was married to my nephew and she died. And, you know, there was going to be a service that was going to be held with, you know, probably a large group of people, and they had to cancel it. I mean, and that's the thing that's happening. But we're not piling dead bodies up in trucks. I mean, that's just not what's happening. And so the more we spread that kind of fear mongering, the damaging effects it's going to have on people. So let's discuss that. So what happens with damage? And you know, you start out with increased anxiety, and so whether it's based on real or perceived threat of the virus, that's kind of what starts to happen. You may start to panic. You start to worry that you're going to be infected. You're worried about your loved ones being infected, and you're worried about the related symptoms. Even though you may have something that's minor, you start to think that you have it, and that's very common when people get like that. Stress is another big issue. So you have sleep disturbances, your overall state of your health, you know, declines, and you've got to remember what you're doing in this process. And I don't mean to play light of this, because this is very real for some people, very, very real. But what you're doing is you're making your host now vulnerable. So remember, the virus enters a vulnerable host, and so if your host becomes vulnerable, then that's just even worse and more opportunity for disease to set in. So there is potential for hysteria. I mean, my God, we've all seen the hysteria. People going and buying toilet paper like crazy. I don't understand that. I mean, I don't understand. First of all, I don't want to be without toilet paper, and I get that. But why toilet paper became the #1 thing is just mind-boggling to me. I mean, I experienced some of this myself. I mean, I have 2 preemie grandsons, and right when this had happened, one of them had been in the hospital for RSV for 8 days. And he has to have special formula because he's tiny. And so I would say that my concern and my panic, my own level of panic, had to do with his formula. And so everything was being wiped out and there was no formula. And I was feeling a little anxious and nervous about that because he's tiny and he, you know, he needs that formula. And so I went one day to we had an order, my daughter had an order that was set from Amazon, but it was delayed and we didn't know when it was going to come, and he was less than 1 can, and a baby goes through a can pretty quickly. Usually it's within a couple of days. And what they did after this hospitalization, not only is he on the strongest formula, but they wanted him to have 1.5 times the amount of powder, which then makes it go even faster. So I one morning was just really fretting about this when this was all beginning, and I went to like 3 different stores, and I was like trying to find the formula. And you know, I was able to get like some of the little sample stuff, not really the whole can, but I got the little 2-ounce bottles, even though he drank, you know, 6 ounces. And I tried to buy what I could find. And then I told my daughter, you've got to stay on top of this as well. You've got to go, you know. So she went to Target one morning early, and they said that the formula, as soon as it comes in, it's like gone. And you know, and one of the ladies at Walgreens told me that another mom had came and she started crying to her because they had formula. She said she had been all over town looking for formula. Now that to me is like, you know, far more important than toilet paper. I mean, it's very scary. And you know, so anyway, I get the hysteria. I really understand that. And some people are going to be more prone to hysteria based on their current mental status anyway. I mean, that's just the way it is. And epidemics are going to lead to stigmas. They just are. We're going to end up, it's going to affect individuals. You're going to have possibly mistrust of authority figures and healthcare professionals because you are bombarded with all this news. And so there's going to be, again, stigmas that develop against these people, which is not going to be right because those people could be any one of us. And it might be. So you could have an exacerbation of anxiety and psychosis-like symptoms, which, you know, lead to non-specific mental issues like mood problems, sleep issues, phobia-like behaviors, panic-like symptoms. And the depression rates are probably going to soar because of this. Now, because COVID-19 is so new, there's nothing really to prove this, but it will happen. You know, just like anthrax, when that happened, it creates a lot of fear in people. I mean, people were fearful to go to the post office. They were fearful of their own mail, you know, when all that, if anybody remembers that issue when that was happening. So COVID-19, again, is going to end up being like that. There will be people that develop issues, either they may even develop OCD. Maybe they didn't have OCD before, but now they do, and they want to wash their hands continuously. So unfortunately, the damage is going to be done. But let's go to the numbers, what they mean, why they matter, and getting some perspective. First, I didn't really touch on this, so I want to go back to this. One of the reasons why this stay-at-home order is so important is because our hospital system has already, in the United States, was running at full capacity, at pretty full capacity, especially during the winter months, during flu season. You know, already in Visalia, we were already seeing that the local hospital had to put up tents, you know, to treat people. That's been happening for at least the last 2 to 3 years. So healthcare systems are impacted and they are inundated. So that's why this is all about, is we're trying to slow the amount of people. Now, I didn't really put a slide in this. I know I had sent things out about this before, but I do want to touch on this. You know, out of the number of people that are going to end up getting COVID-19, there are going to be people that have mild to no symptoms. So that's going to be a certain percentage. Then there's going to be people that, you know, it's a pretty bad sickness. You know, they might get pretty sick, and it's like they're home in bed for 10 days, 14 days, whatever it might be. They might be pretty sick. Then you're going to end up having people that require hospitalization. That is about 20% of the people that have COVID. Out of that number, out of that 20%, you're going to have 5% that are going to be critical. And out of that 5% that's critical, you're going to have people that die. I mean, that's just going to be a given, and that's what's going to happen. So 20% of everybody that has COVID is going to require a hospitalization, and that is why we had to slow this down, because we don't have the capacity in the United States. We have less than 1 million hospital beds, and out of those 1 million hospital beds, some of them are geared for labor and delivery, which you can't put COVID patients in labor and delivery. That's not going to happen. And, you know, so, and not all of those beds are ICU beds. ICU beds actually are a small percentage. When you really look at almost 1 million hospital beds, there's a small percentage that are going to really be ICU beds. And that's why this had to be done, and that's the things that they chose to do to make this kind of slow down. So the numbers mean things, they do matter, but we got to get perspective on it, okay? And that is really, really important. We've got to have some perspective in this. And so every day I am looking at almost all the counties that we serve, but I am able to get this report that it comes from Tulare County, and it's getting forwarded to me through somebody else. But anyway, so I took an excerpt out of this, and it was in the news this morning that we have 157 positive cases. But I already knew that yesterday, because this is the data from yesterday. Now I'll probably get that text. If I don't have it already, I'll probably have it within this next hour, and I'm going to see the statistics for what will be reported in the newspaper tomorrow. And so that number of 157 cases, I don't know, it could go to 172. But as you can see, and I don't know how close are we able to pick that up, Kingsley? And not that you have to move it, but you know, so but we have tested in Tulare County 993 people, and 157 have been positive. There are still 56 tests pending, though, as of this data. So if you subtract 56 from 993, you're going to come up with a number, which I don't remember it off the top of my head. But basically what that boils down to, as out of everybody that's been tested in our county, 16% of them are testing positive. So you're going to have a lot of people that test but are not going to be positive. So that's what the math is. Now, that math may change. That math could end up going up to 20%. It could go to 24%. I don't know. It's going to really depend on how many people are tested, how many cases are going to continue to be, or how much spread is happening in this given county. And these kind of statistics are being tabulated everywhere, in every county, every state, everything. And so, but what we're dealing with is our individual areas. I understand that San Luis County, I think it was yesterday, I don't think they had any new cases. And so they are aggressively testing as well. I mean, just like Tulare County is testing more, so is San Luis County. And the same with Santa Barbara County. I don't remember, I think Santa Barbara might have had an increase, but I don't remember that off the top of my head. So I just want you to get that in perspective. Not everybody is going to have this, and even though they may think they're sick, they don't have COVID-19. Now, this one's a little smaller. I'm going to kind of cover this, and I'm going to explain to you why you're seeing in the media, or what my opinion is of what you're seeing in the media saying we're going to see the number of cases climb. And I'm gonna kind of walk over here to the screen because I want to point something out. And of course, I can't figure out the pointer. I know it's there somewhere, but you will see, first of all, this bottom line. These are the statistics, and this is the United States statistics. This is from the National Centers for Health Statistics. And the bottom column is the death count of the deaths that we had in the United States as of the end of this last Saturday. So if you see deaths from all causes here, you know, at 37,000, and then this next week it's only at 13,700, these numbers are going to actually climb. And it's because people have, you know, hospitals can't report this overnight. These death statistics are going to end up being reported over the next like 2 to few weeks. It takes them a couple weeks to get all that data in. So the week of 4/4 is definitely not an accurate week. 3/28, what you're seeing is you see the increase in COVID deaths. So first you see at the week of 3/29 there was 353 deaths, and now 3/28 there's 1,149 deaths. But you'll also see over here deaths with pneumonia and COVID-19. And the reason for why I want to draw your attention to this, and this is again data that we could send out if you want to, you know, you're interested in seeing this. And oh, one other thing, you're going to notice that in the same week that the deaths climbed with deaths with pneumonia and COVID-19 and the numbers increased, all pneumonia deaths also dropped. And the reason for that is because there is now a new ICD-9 code, which is coding is what everything that's done in hospitals and in doctors' offices and in everything. It drives reimbursement. It is a really important thing. It's what indicates what disease process you have for insurance and all of that. So on March the 24th, when the stimulus plan was done, this new code was created. And so so what happens if the terms are reported on the death certificate indicates uncertainty? If the death certificate reports terms such as probable or likely, these terms would be assigned the new ICD-9 code. And it is not likely that the National Centers for Health is going to follow up with that. So what's going to happen is, should COVID-19 be reported on the death certificate only with a confirmed test? No. You can now report that you just suspect, or you assumed it was caused by, or it contributed to death. So no matter what, the numbers are going to climb. And the reason for that is the stimulus package. You got to remember, I said codes drive reimbursement. So the stimulus package has put a lot of funding for hospitals for the uninsured. And I get it. I mean, I totally get that. You know, the uninsured, there's a lot of people that, you know, that pulls on the system. And so so that's what's going to happen, is this code is going to allow more reimbursement to hospitals. So, but without a confirmed test, you don't really know 100% with certainty that someone has COVID-19, but that's what's going to end up happening. So anyway, you are going to see the numbers climb. So let's talk a little bit about symptomatic versus non-symptomatic. First of all, you've all been hearing the symptoms, I hope. Fever, and this could be low-grade fever. It might be just high 99s, maybe low 100s, but fever. Dry cough, and usually fever, just so you know, usually this fever is more in the afternoon. That's what happens with a lot of illnesses at times. You may wake up and you feel pretty good in the morning, but by the afternoon you're kind of feeling kind of crummy, and you might have a low-grade fever. That's why it's real important, if you're feeling that way, you've got to be checking your temperature. Dry cough, and it is a hacking, dry sounding cough, at least that's what I believe to be. Now, what my husband described it as, because as a nurse, when he was this sick for a while, I mean, it kind of freaked me out. I thought, what's going on with him? And, you know, and I wanted to ask questions. Are you feeling it in the back of your lungs? I wanted to know, did he have a pneumonia? You know, where is he feeling this? And how could he cough so much, and where was he feeling it? And he described it as feeling right here around his sternum bone, around his breastbone. And when I read that just X amount of weeks ago, that he told me this back in February when I was trying to assess him and figure out what was going on with him. And when I read that just a few weeks ago, that's when I realized, I bet my husband had this, because that's exactly how he described it to me, as I feel it right here. And he didn't have phlegm really. I mean, he occasionally at the very end got a couple stuff up, but not very often. Another thing I put on there, difficulty breathing. So shortness of breath, difficulty breathing is a prime symptom for this. Another one that the WHO has not, the World Health Organization, they are reviewing this symptom, but it hasn't been completely put out there yet, but it seems to be that people have a loss of smell. And so I don't want to, confuse that because I don't want to project that that's necessarily what's happening, but it's looking like the data is showing that loss of smell is a big issue with this. Now, let's talk about non-symptomatic people. 1 in 4 positive cases will have no symptoms, none. Now they could have had some symptoms that were mild, but they just shrugged it off. I mean, some people are like that anyway. They're like, I kind of feel yucky, but I'm gonna take a couple ibuprofen or Tylenol, I'm gonna go push through it and go to work. This is not the time that we want to be pushing through something and going to work. And believe me, I'm guilty of it myself. I mean, I definitely have done that. And so the one thing about this virus that it seems to be that they're seeing is that unlike other illnesses and other viruses is that you are shedding significant virus prior to symptoms. So the people that are tested positive, or you're finding out they're tested positive, chances are they were probably real contagious 5 days ago. And that is the part that is going to be something when it comes to data and numbers that we all have to recognize. You have to treat everybody like they could be contagious. Because if that's how this virus is working, unlike the other flus, where you might be more contagious on day 5 or something like that, day 5 after being sick, this they're seeing is the shedding of the virus is happening heavily in those first 48 hours, and 48 hours actually before diagnosis. So again, that's how that's kind of playing out. Some people, again, could be very, very mild symptoms and they don't even think they're sick, and it goes completely undetected. And that is probably part of the reason why we're facing a pandemic in the first place. So, universal precautions. Now, I have been running Amdal for, 20 years now, almost 21. And this was drilled into me as a nurse. But you need to remember that anyone and all body fluids can be infected with something. And you cannot ever let down your guard on this. And I hope that if there is one thing that comes out of this pandemic that none of us have ever seen in our lifetimes, is that you will really take that to heart and that you understand that. And so I don't want to play light of how COVID is, but yeah, you could get COVID, and there's going to be a lot of people that get COVID. But I would rather have COVID than I'd rather have hepatitis. I mean, that's just me personally. I mean, hepatitis may damage your liver, it may cause you to need a liver transplant, and it could definitely cause you to die. And so a lot of people are gonna recover from COVID. A lot of people don't have a good run with hepatitis. And so that is why it is critical that all body fluids have got to be looked at as being contagious. Now I wanna touch on something else before we get into some other things here, but another fake news type thing. And this little picture here, I've been seeing float around on Facebook. And as you see here, it shows a cloth mask, 0% effective against a virus. This right here, and it says a surgical mask is 95% effective in a virus. This is an incorrect slide. And I will show you that you can look this study up that was done in 2013, and actually the stats on a surgical mask are not that high. Now, an N95 is at 95% filtering out a virus, but a surgical mask really only sits, I thought the numbers were in the 70%. It is not 95% of viruses are protected by that little surgical mask, so please don't think that, because that is not true. Now, a cloth mask, in the other hand, that's also not true, saying that it's 0% against a virus. That is not true. A cloth mask, if it's used with the right kind of material, has the ability to filter out 50% of a virus. And so that is one of the reasons we started doing that. And as this thing was growing, and I could see that we couldn't get supplies, and believe me, we are going to be low on the food chain. When supplies start filtering down, they are going to be going to hospitals first. They're not going to be coming to companies like ours, and that's just the way it is, unfortunately. So when I did some research and I discovered this, I reached out to my mother right away, because I figured we need to start having mask protection, and we've got to get as many as we possibly can. She started sewing masks that day. I mean, just God love her, I was so thrilled that she did that. And then I reached out to our administrative staff, and I just want to thank certain individuals. Erin and her team at the Coast, I understand, and I haven't been there, and I don't want to get emotional, but I understand they've got masks, being made all over the table. My mother is sewing masks like crazy. She has more to come to us tomorrow. She's, sent us 100 last week. She'll probably send us another 100 this week. I know that Serena has worked with some of the staff here, and they are making masks. They're cutting material. They're doing all this. I mean, our goal is to get as many masks into people's hands as possible. I mean, that is what we want to be able to do. So a cloth mask does work, and you have to remember this about a cloth mask, and this is what we're doing, as we are using a heavier cotton, 100% cotton. You know, so if you're gonna go cut up your t-shirt and think that that's the same, it's not. We're doing double 100% cotton, and that's what's shown in this study, that will take out 50% of viruses. Okay, now let's get into what is considered minimum personal protective equipment. And I talked to somebody the other day, and they had a really big misconception of the word personal protective equipment. Gloves are personal protective equipment. Mask is personal protective equipment. You know, gowns are personal protective. All of these things are eye protection, are considered PPE. All of it at once doesn't mean PPE. So this person thought that head to toe is PPE. No, gloves are PPE. So, and not every piece of PPE is needed for every situation. So in the highest level of who needs PPE is those performing aerosol generating procedures, including inducing a cough. And so the other day, Alex was here in our office, and I showed him what coughing and deep breathing is, and you know, and I percussed his chest a little bit, and then I had him do a couple coughing and deep breathing. I induced him to cough. That's what inducing to cough means, is, you know, making somebody forcefully cough and get something out. So that's the group of people that needs the highest level of protection. This includes those ICU nurses, the nurses that are in there with those ventilators, the respiratory therapists. They're taking apart tubing, they're putting, nebulizer breathing treatments, they're suctioning these people. They are the ones that need this level of protection. Another group that needs this level of protection are these little drive-by things that you see where they're testing. Now, I've seen the picture of what this looks like. I haven't watched a video on it or anything like that. But to do this testing for COVID, it appears that it's some like huge swab going into your nose, like really deep in there, you know. And so what that's going to do is that is going to induce somebody to cough. It could actually induce somebody to vomit. I mean, you know, having something go that far in you and what they have to do. So those people that are garbed up, you gotta remember, this is a drive-by. So you're also really close to them. You cannot practice social distancing with somebody when you've got to do a test on them that close. So these people have to be totally garbed up to protect themselves, because that person they're being tested, they may just like spew on them right then. I mean, and you've got to be prepared for that. And that's what happens when you're a nurse in these high level situations. Now, when you have prolonged close contact with a COVID-19 patient not wearing a mask, so there's a difference here. This is a COVID-19 that's not wearing a mask. You need a face mask and you need eye protection. Gowns and gloves, and don't get me wrong, I want us wearing gloves as much as possible dealing with people. But they are only required if you are having extensive contact with body fluids or with them. Not body fluids, I'm sorry, with them. So if you were, for instance, and we have some patients like that are completely bedbound, and you know, our staff are turning them side to side. You know, they're in hospital beds. They might be having to, you know, roll over them to get them, you know, maybe they're cleaning them up from incontinence and things like that. And if that person was positive for COVID, that's when our staff should be wearing a gown. So that's what that is then you have prolonged close contact with a COVID-19 patient wearing a face mask. The only thing you need in that situation is a face mask. So face mask to face mask when you're going to have contact with somebody that's not close with body fluids and things like that. This one, I hope that this is the CDC guidelines, and I'm going to spend a little bit going over this, but this right here is prolonged close contact with this now is the rating system for what it means for you as individuals when it comes to work. So and this word HCP stands for healthcare provider, and you're going to see it up here in the slides. But this is what is recommended if you have prolonged close contact with a COVID-19 patient who was wearing a mask, okay? So the patient's wearing a mask, but you're not wearing anything, okay? So your exposure is medium, all right? And if that was to happen, you need to be excluded from work for 14 days since your last exposure, okay? So that, right there, I hope everybody's getting it. You need to be wearing a mask. I mean, that's, if you're taking care of somebody, either in transport or in home care, you need to have a mask on, okay? And that right there is gonna reduce your ability of being in the medium category. So then, you're not wearing a mask, you're not wearing a face mask or a respirator, you know, wait. It's still medium. Why does that one look different? You have no mask. Why is that one the same? Am I the only one seeing that?
The first one is if you're wearing nothing
None.
at all, and the second one's not wearing a face mask or respirator. But
Isn't that a double?
maybe gloves.
Yeah, I don't know why that's okay. So anyway, but that second one down, also medium category. I don't know what that one is, but so then you're not wearing eye protection. Now again, this is a patient that's wearing a face mask. Your exposure is low, okay? Your exposure is low, but everything, no matter what, you see how it says here, is it recommended that you are going to be out for 14 days or anything like that? No. But it is still self with delegated supervision. And what that means is you are following up with yourself. Like we've had, and you are gonna see it in our company. We have somebody currently here that is wearing a face mask, and it's because she had some exposure with somebody, and so she's monitoring to make sure she doesn't have a temp for 14 days, and that face mask is actually protecting all the rest of us in case she does have an exposure, or she could be positive. So if you're not wearing a gown or gloves, a low category. You're wearing all recommended PPE except wearing a face mask instead of a respirator, you're low again, you stay low. So the key thing is when the client is wearing a mask, your exposure is either low to medium depending on the situation. And it's definitely low when you end up having a mask. Now, if the person does not have on, was not wearing a mask and you're not wearing a mask, then you are in a high category for exposure. And that means that you need to be excluded from work. There is you have to actively be monitoring yourself. And when I say monitoring, this could even be public health being aware that you have had something, and it definitely means we're aware. The one thing that happened in all these law changes, as an employer, we really have no rights to ask about your health issues. I mean, that's not our business, and it's very well protected. The one thing that they did do, though, is that we as an employer have rights to ask about your healthcare issues when it comes to COVID. And that needs to be done, because if somebody has that level of exposure, and I'm not talking necessarily here at work, it could be at work, but it could also be at home. And so if you've had some kind of exposure with somebody that is active with COVID and they were not wearing a mask and you were not wearing a mask, then we're gonna have you be monitored and be out of work, because it's not gonna be safe for you to be taking care of somebody. Now, if you're not wearing eye protection, same type of thing, and they're not wearing a mask, then it lowers down to medium. So I can't stress enough, mask is the #1 thing. Now, if you are not wearing gown or gloves, you drop down into a low category. So the person, again, not wearing a mask, you don't need necessarily a gown or gloves, and you don't have to have work restrictions. Throughout this whole process until this pandemic is over, you need to constantly be thinking about yourself. And that means you're not gonna come to work if you have a fever, a cough, or any shortness of breath. And that's what a lot of self with delegated supervision, I'm hoping that self means you're taking a lot of that responsibility on yourself. I mean, and if you've had some of these exposures, we need to know about it so we can help monitor that as well. Okay, the future in caring for Amdal COVID-19 clients. A pandemic is going to touch everything until it stops. And now it can stop because of weather. I mean, they don't know why California statistics, they're thinking that maybe because we did the shelter at home, quicker than other states did, that our curve is not doing what they thought it was going to do. It actually, our curve is really coming down nicely. And you got to think, we're also experiencing some better weather here. Well, it's raining and yucky now, but the temperatures are going to be increasing, and usually viruses don't do well with heat. And so that is, and this virus does not, by the way. And so this could kind of stabilize. But there is a possibility that it is going to reappear in the fall. And when the weather gets bad again. So it's either going to run out of susceptible hosts, or it becomes what is called endemic. And endemic is going to mean that it now is just going to be a disease that is in all the diseases that we have, like flu or anything else like that. It's gonna be something where it's touched everybody it's gonna touch, but then in the winter months, it comes back again. Somebody gets COVID, they don't, they get a flu shot. Maybe there's gonna be a vaccine created, maybe it's gonna work on some of the population, maybe it won't. So that's what endemic means, is it, this pandemic is what we're facing right now, but this could end up becoming an endemic problem. So our goal is to make it as safe as possible while caring for clients and ourselves. And fear is not healthy for overall well-being of yourself and for your clients, because when you're fearful, you sometimes are going to forget all the things that you've been trained to do, and you're going to get sloppy with doing those kind of things, and you may freak out your clients, and so it's just not good. And I do empathize with people that have those kind of experiences. One of the things that I'm having done is we are trying to research for an employee assistance program. We don't have one right now, but I want to try to implement that in place. And so if there is somebody that's going through a lot with this, that hopefully we can find a resource that they can talk to somebody. I want to be able to offer those kind of resources to our employees, because this can be kind of frightening. Remember your training and everything we continue to learn to be as safe as possible. We are going to have COVID clients. There's just not anything that we can do about it. Just as we will have COVID positive staff. We haven't had any yet. In both companies, we have had people that are being tested, that are being monitored, and the people that have been tested, they so far have all came back negative. But that doesn't mean that we aren't gonna have somebody that's gonna test positive, because we are. People in healthcare are exposed to every disease. There is no denying that. But people in healthcare are usually more cautious than the average person. My good friend is in charge of employee health at a large hospital, and so far every person that they've had positive has been traced to outside sources. It did not come from inside the hospital. And that's because we get a little lackadaisical when we're not in a healthcare environment. We're going to the grocery store, we're doing various things, we're talking to our neighbor across the fence line or whatever it might be. And so that is what's being discovered, is that it is not necessarily always coming from being a healthcare provider, because we are cautious. 97 to 98% of people that are diagnosed with COVID will survive. And that is what is really, really important to understand. Get your head around that number. Most people are going to survive this, and they're going to be fine with this. Yes, it's going to be uncomfortable. Yes, this is a pandemic. Yes, it's very scary, but most people are going to survive. And this is what my commitment to our Amdal employees and my expectations from you. First, I will continue to closely monitor this situation and stay abreast of all the CDC guidelines and continue to communicate with all of you. We will be providing additional sick leave, even though healthcare was exempted from that law. So you may have been hearing that about this 80 hours of sick leave. Well, that they exempted healthcare workers because they know they can't afford for the healthcare workers to go out. But I don't necessarily agree with that. I do think we are going to have people that have COVID or have exposure to that. So we will be honoring portions of that leave. We won't be able to honor it all. And that includes the portion that has to do with if you don't have childcare. I want our employees taken care of, and we are going to be able to have, we will have sick leave, and we will have more on that coming out within the rest of this week. But know that it is going to be available. So if you're diagnosed or you're being monitored for COVID, and that means monitored officially, that doesn't mean, I think I may have got it, I'm going to call off, I'm going to stay home. No, this means that a doctor has recommended that you need to, self-quarantine or self-isolate for 14 days. We will continue to have our managers review and evaluate situations for the safety of clients and employees alike. So that means that when it comes to David with dispatch and when it comes to all of our other people in transport, we're going to be looking at situations that we're being asked to do. We're going to try to ask as many questions as possible. Same when it comes to the care side. Our care coordinators, Serena is helping to oversee a lot of this, and that we are going to be making sure that home environments are as safe as they can be. If gloves aren't in home, we're getting those gloves in there, and all of those kind of things. So we will continue to get supplies for safety as soon as we can and be as creative as we need to be in this kind of situation. We will continue to coach and train you along the way in this new environment, because it is a new environment. What I want to ask from you is that you stay home when you're sick. That is the number one thing you can do, and I totally get it if you worried about finances and things like that, but this is not the time I want you to come to us if you're having those kind of dire issues, but I need you to try to stay, I need you to stay home when you're sick. If you need to try to practice some self-care of your mind and body. Turn the news off. I can't stress that enough. Don't listen to this 24/7. I mean, my husband has it on a lot. I'm good at tuning the news out. He's always been a news watcher. He turns it off at times. We'll watch like a movie and do some things like that, but turn that news off. I mean, some of it is fabricated, some of it's embellished, and I'm going to give you an example of this. All of us have seen on the news when they build up that there's going to be like a massive, like hurricane or coming in, it's going to be a category 5 and it's going to knock out a coastline or whatever. People are running, they're getting sandbags, they're getting food, they're doing all these things, and then it comes in and it's, a level 1 or it's a tropical storm. But the news is like, that's all you see. I mean, that's all you see. I mean, and I don't know if one of those last big storms, and it was kind of comical, and we used to see this guy all the time. He would be standing there braced in the wind, and it was like, he's like all holding his microphone, and the winds are supposedly like, 100 miles an hour, and this guy's doing this. And they ended up showing later that was all fake. They showed that guy within like a wind tunnel thing, and it was a screen behind it, and he was always in the same spot. And I remember this was on a big national channel. This wasn't just some funky video that was being made up. This was a national channel, and they busted this guy. I mean, it was all fake. I mean, and you know how you noticed it was fake is because he was all blown out like that, everything blowing on him, but the trees in the background weren't even blowing. And it was like, how could 100-mile-per-hour winds going and the trees aren't even blowing? So turn that news off. Do something positive. If you have a backyard, if you have the ability to get out in some sunshine, try to do that. I mean, try to find some joy in your day and don't be focused on all the negative. I want you to remember the things that you can do to reduce disease at home, in the community, and definitely with your clients. I want you to use your judgment and you report to your supervisor any situation that you believe is unsafe, because I do not want you to think that we are intending to put you in an unsafe situation. And so what we hear, what we assess can change tomorrow. And so if something changes and you don't feel right about something and it just doesn't feel good, it's not right, you need to call into your supervisor and you need to say, this is what I'm experiencing, this is what I'm seeing here. I know this person was told we're asymptomatic, but they're coughing like crazy. Or I was told that, that they had gloves in the home and there's nothing in here. There's no soap to wash my hands. You need to report those things to us. Again, communicate lack of PPE, soap, or cleaning supplies in the home or in transport vehicles. And I ask that you follow the care plans that you have and the direction that you've had for transport training. Now, I've talked a lot. That was pretty long, longer than I thought it was going to be. So, does anybody have any questions before we wrap up? I want everybody to know, if you come up with questions or concerns, I want you to either write them to your supervisor, communicate them to your supervisor, and we will try to address all of those. I mean, my goal will be to continue to do things like this and continue to get out information. So if there's something specific that you want more data on, I just need to know about that, and I will continue to try to get information out there. So I want to thank all of you, and we will all get through this together.
Thank you.
Thanks.